Hello, this FERNE educational video discusses the care of ED patients with dizziness and vertigo with the intent to appropriately diagnose and treat serious central etiologies. And we're going to now have a special discussion of how the HINTS Plus exam was built and why HINTS Plus Plus is listed in these FERNE educational lectures. My name is Edward Sloan. I'm an emergency physician in Chicago, and I'm with FERNE.org. More about FERNE later. A special thanks to Peter Johns, a physician at the University of Ottawa, who provided some comments to our YouTube channel that helps in the development of this particular educational video. So, what is meant by HINTS Plus and in parentheses plus? This is physical exam testing to be done in patients with acute vestibular syndrome who are profoundly dizzy. Now, the HINTS exam itself includes three things: head impulse, nystagmus, test of skew. The added HINTS Plus includes checking for unilateral hearing loss. And then I've added the additional plus in parentheses that adds an exam for truncal ataxia and ataxic gait, as well as any anterior stroke signs. If any of these are found to be positive, you know then the patient is red lighted and you have to consider a central etiology. So how was the HINTS Plus exam built? The HINTS exam itself includes the test for head impulse, nystagmus, and test of skew, knowing that we do nystagmus first because head impulse test is found to be most useful and validated in patients who have nystagmus. So where did HINTS Plus come from? Well, in fact, HINTS Plus, as we stated, includes a check for hearing loss. That was done by David Newman-Tokar, a physician with an interest in dizziness and the treatment of these dizzy patients. So we look at the National Journal Club from FERNE, and we look at a study comparing HINTS to the ABCD square for the detection of posterior stroke in acute vestibular syndrome patients. This 2013 publication demonstrated that if you had not only an exam that included HINTS, but it added additionally unilateral hearing loss assessment, that the area under the curve here in yellow was virtually all signal and no noise. This study demonstrated that in virtually all groups, the HINTS Plus unilateral hearing check was in the high 90s with regard to sensitivity in all age groups, suggesting that it should be done. And in fact, the HINTS Plus exam allows for the detected neurological imaging and disposition home for some AVS patients. So why the additional plus, HINTS Plus and in parentheses plus? We go back to the FERNE National Journal Club and we look at the issue about whether or not nystagmus and truncal ataxia are correlated. And in fact, a publication just this month by Carmona 2023 looked at a series of acute vertigo patients, and in fact 15% of patients had no nystagmus but did have ataxia, such that Carmona suggests that the HINTS exam must be supplemented by the neurological exam to include a search for truncal ataxia. So if you talk about HINTS Plus and in parentheses plus, we go back to the first slide and we say HINTS is worthwhile. Nystagmus, head impulse, test of skew. The addition by Newman-Tokar, look at hearing loss, unilateral hearing loss. And then the additional plus includes a check for truncal ataxia and gait, knowing that ataxic gait and truncal ataxia are bad, and looking for anterior stroke signs. If any of these are found, it's a red light because a central etiology is to be suspected. Again, my name is Edward Sloan. I'm FERNE President and Board Chair. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo, and follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. FERNE.org. Please leave comments here on our FERNE channel, or you can email us at fern.org@gmail.com. Thank you very much and have a good day.